My name is Shane Francis Gillett, and today I will be presenting the Responding to the Health Needs of a Survivor of Human Trafficking. It is a trauma-informed nursing case study.
First, let us know what is human trafficking. So, human trafficking is a serious violation of human rights and a major public health concern. Survivors frequently present to healthcare settings with complex physical, psychological, and social needs. Nurses are in a critical position to identify potential victims, ensure safety, and provide trauma-informed and culturally sensitive care. So this case study describes a healthcare encounter with a survivor of human trafficking and highlights appropriate nursing response. The history of present illness. So the patient presented to the emergency department with vague physical complaints, including chronic pelvic pain, dizziness, and generalized weakness. So during the assessment, she avoided eye contact, answered questions hesitantly, and allowed an accompanying male to speak on her behalf. Her personal history was inconsistent, particularly regarding her place of residence and employment, and she appeared fearful when asked about her living situation. History of past findings, so there were no previous medical records or valid identification documents available. The patient reported with no regular access to healthcare and was not enrolled in school or employment and hold limited proficiency in the local language. Physical assessment revealed multiple healed scars on the arms and legs, signs consistent with untreated sexually transmitted infection with poor nutritional status, an anxious, hypervigilant presentation with minimal verbal responses. So for the nursing assessment, this includes presence of controlling companion, lack of personal identification, fearfulness, and ability to speak freely, inconsistencies in personal history, and physical signs of previous abuse. So in response, the nurse arranged a private assessment using a professional interpreter and ensured that the accompanying individual was not present. Disclosure and nursing response was done during the private interview. The patient disclosed that she had been forced into exploitative labor and sexual activity after being promised employment abroad. She expressed fear of retaliation and possible deportation. So the nurse responded using trauma-informed principles, including non-judgmental communication, open-ended questioning, and respect for patient autonomy, and assurance of confidentiality within legal limits. The nursing interventions, it focuses on conducting a comprehensive physical, psychological, and social needs assessment, ensuring informed consent for all procedures, and coordinating referrals to mental health services, social workers, and specialized anti-trafficking support organizations. Care was delivered through a multidisciplinary approach with patient safety as the priority. So for the nurse's role, as a nurse, strict confidentiality was maintained, mandatory report requirements were clearly explained, and documentation was secured and limited to essential personnel. Law enforcement involvement was avoided unless legally required or consented to by the patient. The patient had already been connected to the post-trafficking support services, including temporary shelter, legal assistance, and trauma-focused psychological care with follow-up appointments arranged. In summary, this case underscores the pivotal role of nurses in recognizing the subtle indicators of human trafficking. By delivering holistic, trauma-informed care that integrates ethical standards with cultural sensitivity, healthcare professionals provide the essential foundation for a survivor's recovery.